Hello, and thank you for joining us today for Memphis Light Gas and Water's Power Pivot Small Business Webinar. I am Gale Jones Carson, the Vice President of Community and External Affairs. Power Pivot is an online series in which we talk to Memphis area small businesses and hear their stories about how they have pivoted to a new normal during the COVID-19 pandemic. We invite local industry experts to give advice in areas such as finance, accounting, marketing, real estate, small business grants, legal issues, health and safety, and energy savings. Before moving on, I'd like to ask Zoom attendees to put any questions that you may have in the Q&A section. Also, Facebook viewers, please put your questions in the comments area. Today, our guest is Rick Black. Thank you, Rick, for being on with us.
I really appreciate you inviting me. Thanks.
Okay, so Rick is the owner of CORPRO CPR and First Aid Training, and he's also an authorized trainer for the Occupational Safety and Health Administration, which is OSHA. So Rick, I'm sure everyone has heard about the OSHA mandates that have been recently been all over the news. And some people might be confused about what it means for their businesses. But before we go into discussing, what the new mandates actually mean, would you tell us a little bit about yourself, your background, and share some insight about the new OSHA directives?
Of course. Thanks again for having me. Well, my name is Rick Black. I am an authorized OSHA trainer, and I have been in business for about 6 years now. This is a retirement gig. I'm retired from the federal law enforcement, actually federal prison here in Memphis, where I was for about 25 years. I served there doing engineering support in the facility maintenance, and as part of other duties, of course, my collateral duty, I was the lead CPR instructor. Prior to that, I spent about 10, 12 years designing homes here in the Memphis area, some engineering work at a couple of other places, and 3 years serving, worked for my uncle, Sam, in the Army. Total of 9 years of active and Guard Reserve duties. So quite a diversified background. I didn't realize until I started teaching so much here in the community as conversations come about that you might think that, man, this guy had a hard time holding down a job, but it has served me well. That and then the ministry work that I did for 26 years, mentoring young men and adults in ministry. So, and then when I got, after retirement, having been a CPR instructor, I started my own business. Started doing a lot of studying. I was reading all of the books of how to start a business, got me an SBA mentor, watching Shark Tank and all that stuff. And a safety company hired me to do some CPR and first aid training for him. And as I got to hanging out with him, I realized, I said, hey, all this safety stuff that you're doing, a lot of that was part of my responsibility when I worked for the federal prison system. So I made a few trips up the road to Nashville and became an OSHA trainer. And my construction background and safety training and everything has served me well. I'm really blessed to be able to do that to help folks. And as a small business owner, you can imagine how thrilled I am to be a part of this, to be able to share with other small businesses. We have our own unique challenges, obviously.
Well, you definitely have a wide range of experience that brings you to where you are today, out of retirement and into something else that you love to do. So, Rick, let's move into the new mandates that have been issued.
Okay, let me start. As you mentioned, everyone's heard of this federal mandate. Well, the problem is, as it has been since the beginning with the COVID situation, well, what is the right information? When is the right information current? When is it not current? Who did it come from? So being a good government employee, I pulled up a government document. If you would, the mandate itself, if you'll bear with me, I want to give you a quick summary, about 2 or 3 lines here. That actually is the mandate itself. This is not from MSNBC, Fox News, the water bottle at work or anything. This is the directive. The Occupational Safety and Health Administration is issuing an emergency temporary standard, the ETS, to protect unvaccinated employees of large employers, 100 and more. Now, I know some of you are thinking, okay, that eliminates me. I don't need to listen. Now, hang on. From the risk of contracting COVID-19 by strongly encouraging vaccination. Covered employees must develop. You've got to develop, you've got to implement, and you have to enforce a mandatory COVID vaccination policy, with the exception for employers that instead choose to either get vaccinated or elect to undergo testing and wear face masks wear the face mask and get tested once a week. So that's kind of it in a nutshell. If it's a large company, 100 folks, 100 employees or more, then you're mandated. Well,
let me, before you move on.
Okay.
So how does this impact government employees, municipalities versus the private sector?
Well, if you're federal contractors, they are mandated under this ETS as well. Now, the local municipalities like MLGW, of course, you know better than I what your policies and mandates are. They tend to err on the side of, while the politicians and everyone are trying to figure out what to do, they have a tendency to go ahead and implement a mandatory vaccination program, or the election of the testing.
Well, now, Rick, we have a challenge here in Tennessee. In Tennessee, even though we have this federal mandate coming down from the president and OSHA, and OSHA, our state legislature have passed laws, and the governor has signed into law some laws that actually conflict with these mandates. So a lot of companies are just like, they don't stand by. They don't know what to do. They don't know what to do here in Tennessee.
I love your challenge. I love it. I'm so glad I did my homework. This is great. Yes, absolutely. So as a nation, we knew that this was coming months before it was implemented. November the 5th, I believe. No. So people started preparing. People being the various states and the circuit courts. So within almost immediately, it was challenged. I mean, literally within hours, this was challenged. And so it is on hold now, this federal mandate. And it was challenged on November the 10th by 26 different states. And it currently, as of the following week, and it was challenged by several circuit courts. And it has just been, last week, it was assigned to the Sixth Circuit Court out of Louisiana. They kind of put it together through a lottery that they chose which court would take it. So it's being challenged at a national level. The resources that we're going to provide, let me hold off on those for a second before you put those resources up. Get ahead of myself here.
Yeah, because you do have a presentation, right?
I don't have a presentation, but I have a list of resources, yes, that I want to put up for you. For those folks that are watching. And you mentioned the conflict with the state, with our locally here in Shelby County. We have the Shelby County health directives that come out that are updated. It was updated. Health directive number 28 was updated just yesterday, actually. Wasn't a lot of changes. Basically, it added, for the children 1 to 5 years old. And let me make sure I hit a couple of highlights that are going to apply to us in the small business especially public. First of all, the vaccination is not mandated right now as of the Shelby County Public Health Directive. There are no mandated vaccines, okay?
And even they've lifted the mask mandate. So it's not strongly, you don't have to, it's not a mandate, it's just encouraged, right? Except in the schools.
The
Except
face
in the schools.
coverings,
Yeah.
the face coverings are not mandated. They're, of course, they're encouraged. And this particular paragraph kind of addresses that. You do not have to wear the mask unless you're entering property in which a private entity, and I'm reading the mandate here, or that entity or that authority requires you to wear a mask. If you're going to someone's private business and they're requiring it, then you need to wear it. And they are supposed to post mask required. Now that may apply to you. You can require people coming into your private business to wear a mask. It is your private business, but they're asking the mandate, or excuse me, the directive says you've posted mask required on the door. In recent days, weeks, but some cases in days, we've seen those signs on the door come down, and then we've seen those signs go back up. So I think we as consumers ourselves, if we go throughout the community going into places of business, I think we've come up with this routine of looking at the door. Are they requiring masks? And we stick it in our pocket and wait till we get to the door. See, do we need to put our mask on or not? That is in the directive. There is preventive measures for all businesses and schools. You must comply with the state and the federal COVID-19 safety requirements. So let's say if this mandate were become effective and it applies to you, you've got over 100 employees, then the Shelby County directive, of course, would adopt that federal, or if there were a state directives, it would adopt that as well.
But the state conflicts with the federal.
Yes, the state must comply with the federal. And OSHA in general, even before COVID came along, there is we have a Tennessee OSHA. Not all states do, but Tennessee has its own safety program similar to the federal OSHA. And they basically fall right in line. There are very few no exceptions. They must adhere to everything federal, then maybe add a few things, but there's not a whole lot of difference with the TOSHA requirements than there are with the federal. The following preventive measures are highly recommended, and I'm looking at the Shelby County directive, highly recommended, and they've even got that in bold type. Place signs at the entrances, ensure proper ventilation, continue promoting all those things that we do, the distances, the washing the hands for your workers. Have a plan. I'm going to come back to that one. That's probably the biggest takeaway that we're going to have during this whole thing. Have a plan in place. And then encourage the use of outdoor spaces if you can, where that's appropriate. I've skipped it here, but I recall another place in our health directive there where masks are required, not encouraged, but required, are those places like airplanes, public transportations, those confined places as you're entering or if you're boarding, and that includes the Uber drivers and things like that. If you're in with the public in a closed space for transportation, then they are required under the Shelby County directives.
Well, I know that I've been traveling recently, and when I've gone to the airport, there are announcements that say that there are federal laws that require that you wear your mask. It also states there is a financial penalty and possibility of going to jail. So the airports are definitely serious about the mandates.
Yes, they are. And at this point, something crossed my mind, and I have to be careful because when you're presenting in something like this, every one of us on this presentation, we have our own little personal take and opinions about it and stuff. I will share this. And by the way, just for the record, I don't represent MLGW. This is Rick Black. In the height of the COVID I was in West Memphis conducting a training. It was only 3 people on a job construction work site. I was setting up my laptop and preparing for the presentation. And the young man was going on about COVID wasn't real and that it was all a scam and on and on and on. And he wasn't going to get vaccinated, blah, blah, blah. And of course, I just let it go. Being professional, I didn't want to go there. And then he just got in my face and said, so tell me, Rick, do you know of anyone who's died of COVID? Just so happens a week prior, I attended 2 funerals, 2 close friends of mine. So I answered the question and he had no more comments. But anyway, so yeah, going back to what brought that up, the airport, the public transport.
Rick, before you go on,
Mm-hmm.
what you just mentioned about having 2 friends who had just passed
Mm-hmm.
from COVID or COVID complications. I find it really difficult in this day and time with so many thousands, literally thousands of people who've not only been positive, but who have died in this country. I find it difficult to, when I learn that there are people who don't know people who have been positive or people who have died. That is just absolutely amazing to me. It's amazing to me that people don't know folks.
Apparently they don't know many people. But and here today, what we want to focus on, I believe today, is as small business owners, as business people, government or private, whatever, what do we need to do? What do we need to know to deal with this, regardless of our beliefs or political persuasions or what we think about COVID or anything? It is a reality for a business owner that oh my goodness, how many businesses have absolutely gone under because of COVID? Whether you believe it's real or not, you no longer have a business. And
over 100,000 businesses
have gone.
And
those of us attending this webinar right now, just for conversation's sake, everyone has a business or a place in the business world. We need to know what's going on. Let me show you 3 resources that they'll bring up for you to look at, in particular, that you can look at later. I'm not going to go over them in detail. The first one is Small Business Safety and Health Handbook. Now, while this is it's an OSHA document, it's a pamphlet, probably about 75, 80 pages. Even before COVID, this was kind of a guideline for small businesses, very specifically, particularly, some things to do to address your safety concerns. People slipping and falling in your business and all that kind of stuff. The second resource there, the recommended practices for safety and health programs, very similar to that, except this geared more for all businesses. And be honest with you, most of it is geared for construction and manufacturing, because I use that a lot when I do my safety consulting with construction industries. The last one there is the OSHA's Emergency Temporary Standard. That deals very specifically, 100% totally with our subject at hand, the vaccine mandate. If you go to OSHA.gov, the first part of that URL, OSHA.gov, you'll have more information you ever wanted to see. And you click on their coronavirus link there right on the homepage, and it will take you to just a massive amount of resources, every one of them concerning this mandate. Now, again, it's all on hold right now. But what I would recommend, and we can bring it up here, show you one of those resources will be this little document here. The word, all you need to know is a template. Do you have a plan in place in your work to deal with vaccines, COVID, masks, stuff like that? This is the template. It's editable. You can go in there and fill in the blank, put your company name. It is a resource on there. If you do that and just have that on hand, as with other safety related things, worst case scenarios, someone has COVID and there's a lawsuit, or someone gets hurt and an injury, not COVID related, whatever. long as you have a plan in place, that shows good faith effort that you're trying, assuming you haven't done anything crazy. That goes a long way. And in the safety area, even aside from COVID, if you have something as a simple piece of paper that you set down and handwrite on it, say, here's our safety plan of how we address, just like you have fire evacuation plans, what to do if you have unfortunately, we have active shooter plans, those types of things. Put something in place for your safety plan, what to do. And right now it's COVID. That third resource deals with your larger companies, 100 plus, but there are some resources there that you can use, fact sheets, and again, you're going to be overwhelmed. And the one at the top, the Small Business Safety and Health Handbook, aside from the COVID topic, I would highly recommend you go to OSHA.gov, click on their publications link there, and take a look at that. It's about an 80-page document. It's, to be honest with you, it's only about 20, maybe 15 pages of reading. Most of it is checklists. Have you checked, are your floors all dry? Do you have your chemicals locked up? Things like that. Just be a good checklist for a small business to have. And again, worst case scenario, something happens, that will go help you protect you from some of those folks that we see on TV at night who will remain nameless. If should there be a lawsuit on your company, you have something in place that says, we address safety. We're not perfect. We didn't get it all, but at least we have something in place. I'm reminded when I worked with ministries, children's ministries, none of the children's workers were allowed to work with children unless they had a background check done on them. Mm-hmm. Did that prevent them from the bad guy coming in? Of course not, but at least was doing your due diligence. And that is my biggest takeaway recommendation that I would have for you on that.
So Rick, I do have a question. When you say lawsuits, do you mean suits filed by possibly employees who feel that the company hasn't done everything possible to make them safe, or customers or vendors who don't think the company has done everything to keep themselves safe?
Exactly, all of those. Anyone could sue you. I remember, oh gosh, about a year ago, we had a guest speaker at one of the luncheons who represented TOSHA, Tennessee OSHA, and this subject came up about especially employees that say, well, you didn't do enough to protect me. You had the plexiglass up, everyone was wearing masks, like again, a year ago when we are all doing everything, and then someone still got COVID and then said the company didn't do anything. There's no guarantee, but their response was, it's extremely unlikely that lawsuit would be successful, because you have shown that you have done everything that you were required to do, and even in some cases maybe gone above and beyond, but you can't prevent it. But yes, absolutely, have something in place. Again, I may be an oversimplification in the example, but get a piece of paper out and a pencil and just write some things down and put on the top of it our plan for whatever.
Okay, so at the beginning of the show, Rick, you kind of mentioned when we talked about the 100 employees or more, you sort of alluded to something regarding employees, companies that have less than 100 employees. So are they to not have to follow any guidelines or be concerned about any of the guidelines?
Thank you for that question. To help to clarify that, it means less than 100. The mandated vaccine ETS, the emergency temporary standard, does not apply to them. However, the other protocols and directives do. Certainly the Shelby County, anything that the state, the federal would, but that particular emergency temporary standard does not.
Okay, so Rick, I just really do, if we could just get a little bit more clarification. I know it's kind of, it's confusing to folks. So is it anything, I mean, you just gave us a plan, these are just minimal things that companies can do and possibly should do to avoid potential lawsuits or whatever. So with the mandates, since they are being challenged in the courts, is everything basically on hold legally for companies with employees with more than 100 employees?
Yes, everything is on hold. However, all of the quote unquote professionals, the legal beagles and folks and all the research that I'm doing and folks I'm talking to are encouraging people with over 100 employees, even though it's on hold and may never be implemented, you would be wise to go ahead and be proactive and get this template, put a plan in place, things like that, and be prepared. Tomorrow, it could be implemented. Tomorrow, it could be totally destroyed. But you have to be prepared for that.
So basically, with the state laws that have been passed in Tennessee and also signed by the governor, as you mentioned earlier, a lot of signs are coming down where it says you have to wear mask, you have to do this, you have to do that. So a lot of companies now are not enforcing wearing masks. They strongly encourage it. But say we have some employees who work in a small area, however, the area is big enough for at least 6 feet, large enough for 6 feet social distance. And one employee decides to wear a mask and the other employee does not. The employee who does wear the mask is very concerned and very worried about working around another employee who doesn't wear a mask and they don't know if the person is vaccinated or not. How do you handle those kinds of situations?
Well, unfortunately, as I had a mentor of mine tell me, there is no such thing as a GBAB, great big answer book for every scenario. What I would encourage people to do, go to these resources, look at what is mandated and what is required. And then when you get in a situation like that, where it kind of falls in between the lines, so to speak, in the gray areas, and that's where the employer has to figure out what to do. And depending on the size of the company, of course, if it's a small mom and pop shop with 20 people, or if it's a large company, you may have to come up with some creative ways to do it. Bottom line is, in OSHA, their mission statement says every worker in the United States has the right to a safe and healthful workplace. And if OSHA were to come in for whatever reason and look at that situation you just mentioned, where it's kind of a gray area, they're going to make their judgment based on every worker has the right to a safe and healthful workplace. There is a book of standards that's like some of us would remember this, some of us listening may not. There was something called a telephone book years ago. That standards book is that thick for each industry, but there's a page at the back of that book, kind of a catch-all. It's called the General Duty Clause. So the employer's responsibility is to make sure that every worker has a safe and healthful workplace. You're going to have to be creative. You may have to, like we did at the beginning of the COVID situation, and you may have to come up with creative ways to have those workers on separate shifts, separate work areas, ventilations. Talk to them. Oh my goodness, please ask them for their input. Help us, out of respect for one another. I respect your position. You respect mine. How can we figure this out? In the construction industry, they were able to get certain workers. You work over here for the first shift and I work for the second shift, or maybe 3 hours here, 3 hours there, different areas of the project or the restaurant or whatever it might be.
Okay, that's some good information. I'm glad you responded. And you mentioned something that caught my attention. You said if OSHA comes in, what would cause OSHA to come visit an organization or a company?
For the most part, you're not going to see OSHA. They're going to come if someone dies on the job. You're mandated to let OSHA know that someone died on the job. And there's some other medical reasons that they would come in. If someone calls OSHA and says, hey, here's what's going on, I need you to come check it out, my boss ain't right, ain't doing right. They'll call Tennessee OSHA or OSHA. OSHA would then decide whether they needed to physically come in or call the company. They would do a little interviewing on both sides, but they could come in upon request. Someone files a formal complaint. But again, the OSHA has this reputation of being, oh my gosh, I don't want OSHA to come in. When you look at their resources on how much the lack of funding they have and the lack of people they have, they are more focused on coming to, case in point, the construction industry where people are falling off buildings and dying, than they are your restaurant because an employee was upset because they had to wear a mask. And they will prioritize it. And I'm not saying they won't come in, and it could be Tennessee OSHA, their health division of the OSHA part too. That's why it's so important. If they come in, let's say they do, generally, and again, I'm not speaking for OSHA, but based on my education, my experience, and the contacts I have in OSHA and TOSHA, first thing they're going to ask for is, where's your documentation? Where is your plan to address COVID? What procedures do you have in place? If you have nothing, it ain't looking good for you. If you
what would the penalty be? What would the penalty be?
Oh my goodness, that varies. That varies so much. It could be anything from $7,000 to $500,000. But those big ones are probably not going to apply here.
Okay.
And a lot of times OSHA will their preference is to address. You're getting into, these questions now are getting kind of into the weeds, some of these resources. And by the way, to this point, before we close, anyone on this webinar is welcome to contact me either through you, however you feel is appropriate. Questions like that, I would be happy to help you out or point you in the right direction or whatever. If, to address particular scenarios. Am I going to get into your case? Of course I'm not.
Rick, you have provided us with a wealth of information today, and I greatly appreciate it. Is there any closing remarks or any recommendations or suggestions that you want to close with for our viewers?
Yes, I would. Thank you for that opportunity to say that. As a small business owner, as I mentioned when we were preparing for the webinar, I said to some of the other team members here, small business owners, entrepreneurs, I guess, if you want to call them, we're the type of people we would prefer to work 60 to 70 hours for half the pay so we can pursue our passion. Some people call that insanity. We call it independence and passion. I would encourage you to continue that. This too shall pass. On a legal perspective, just have your stuff together and prepared for those situations. Most of the times it's not going to happen. And in this case, it's probably not. Statistically, it's just probably not. And you're going to say, yeah, it's already happened to me. But again, I'm rooting for you.
Again, thank you so much. Rick, you answered a whole lot of questions. Let me just put it that way. And as I thank you, I also want to thank our MLGW team who make these shows possible. And that would be Terica Lamb and Candace Spicer, Erica Horton, our IT team, Darren Sharp and Nathan Smith, who we could not get any of this done without their support. But I do want to also close with thanking our viewers for being here with us this year and hoping that we provided you with a wealth of information that would help you pivot during this pandemic. This is our last show for 2021, and we will be looking to do new and different things in 2022 to help and support and provide valuable information to our business community. So thank you all for being with us today. Happy New Year. Happy New Year. Happy New Year.